Are there any corrections to the minutes? Seeing none, the minutes are approved. Next item on the agenda is emergency management. We have a transfer resolution. Dan, you want to come up?
Morning.
Hello.
The transfer resolution that we have this morning is the transfer in the 2024 budget. There was $200,000 put into legislative contingency to support public safety within the county. We're requesting to move the $200,000 into a project account to conduct an EMS study, kind of a system as a whole. Within the county, we have 18 transporting agencies, both BLS and ALS. We also have 53 fire departments who also perform BLS within the pre-hospital emergency care system as a whole. So what we're looking to do is put together a proposal and have an outside consultant do a study of the entire system, right from dispatch, right, so the initial dispatch, how do we dispatch, but not necessarily like the 911 procedure side, but like how we dispatch, what type of call, what type of ambulance, are we effectively using resources side of it and working within state DOH regulations on that, all the way through to the transfer of patient care to the hospital. So comprehensive, looking at the whole thing, looking at staffing, looking at call volumes, looking at dispatch types, looking at what type of resource we utilize, and ultimately to make recommendations for how we can improve the system within our county. I think one of the key things is, the goal of this is to be very transparent and to work with all the agencies that are involved in it. It's been discussed at the EMS Advisory Board. It's been discussed at the Ambulance Directors Association, the concept of this. So they're all involved in it. They're all aware of it. And really, we need their buy-in to have a good study. It's going to take each one of those agencies to participate in this, provide information, and help provide some of those recommendations to the consultant, who will then obviously put together the final report and vet all that information. That's a quick overview. I mean, the EMS system is very complicated. It's not as easy as people think it is. There's a lot of state laws and regulations that we're mandated to follow, but happy to have conversation or take other questions.
Dan, if they do make a recommendation, in order to implement that, we are relying on these agencies to implement. There's no way we can enforce that on them, correct?
Correct. We do not have any regulatory authority over any of the EMS agencies or the fire service within the county. So again, that's kind of from that buy-in from the get-go. And there may be, there's some conversation. I think there are agencies that are open to some changes or to some different things. But to do this, in the best way, I think it's good to have an outside company who does this on a regular basis and has expertise in this to consolidate that information and provide some of those recommendations.
Are they coming to you right now and showing a willingness to participate?
Some are.
Yeah.
And it's more in private conversation than in open dialogue.
Yeah, I guess that's just my concern. If they're not coming to the table,
Right.
then how do we enforce what we might need to do in the end?
And the goal of this and the way that we've been working on the RFP a little bit of what we put out is, there should be a continuum of recommendations, right? It shouldn't be an all or nothing, and it could, one recommendation is do nothing, right? What are the impacts of that recommendation? So one of the things that we're putting in there too is that, they have to, try to predict what the implications are of each recommendation and what that means if we were to do it.
Mm-hmm. That's good. Good. Brian?
Thank you. Colleen, I was kind of half expecting you to run this meeting in Italian, but
Buongiorno.
Dan, good morning, and I'm glad to see this kind of making its way to the top of the queue. We, I work and I certainly support it. It's a major problem. I work with the county executive, Steve Morgan, of course, Legislator Olson on making this happen. This is kind of a dumb question, and I think you answered it, but let's just clarify. I think the quote in here is, at this time, there is no countywide EMS system, all right? It's a lowercase s. And really what you're talking about is the infrastructure, the way things work, working towards something that has a little more structure to it. But again, absent oversight, which we won't have, never have, it's really a facilitation process. And when you refer to system here, I'm guessing that you're referring to a better way to do things and get things done across all the stakeholders, not just EMS, but fire, healthcare providers, local municipality. It's, everywhere law enforcement, anything you can think of that could help create some synergies and, above all else, probably efficiency with the limited resources we have.
Yeah, and to look at all that, right? So when we talk about like the system as a whole, I can kind of say, from 911 to the hospital.
Yeah.
It's, nurse navigation had an impact on the system, right? So how does that play into this now? We've changed some call type dispatches where historically, I said we've had a ALS, Advanced Life Support System, for decades within this county, and is that an appropriate use of resources to send an ALS and a paramedic to someone with a stub toe, right? And so working through call types and determinants in what type of resource we dispatch that. Is that a recommendation? Is one of the recommendations to have more BLS ambulances available, and then we can change that. So we've done that a little bit, where we've changed a couple of call types to be able to recommend a BLS unit to go to that call. All of those take medical doctors to sign off on that, but I want to be really clear, I'm not the one deciding if it's okay to send a BLS ambulance to an ALS call. So kind of working through that, and I think if we look at that more thoroughly, we can see the impacts, and we can look at what the call is dispatched as versus what the call is finalized as. The way it goes out is not always the actual way it is, right? So there's, without going too long, so I could probably talk about this all day, and I know you have other things to do than listen to me. There's 5 different call levels from EMS, Alpha through Echo. Alphas, can we send more BLS ambulances depending on the call type? And if it goes out as an Alpha, is it ultimately an Alpha when medical providers get there and determine what the actual issue is? So kind of being able to look at that in a comprehensive manner and make other recommendations to better utilize resources.
So, thank you. That helps. And then a technical question. Obviously, this is a national crisis. This is not unique to Central New York in any way, shape, or form. That being said, we have a procurement process. You got to go out to bid. I would imagine the folks you need helping us are pretty busy. So, do you think there's an appetite out there to get it done, to help us
to do the study
promptly?
and help us?
And yeah.
I think there is. We've done different levels of it, right? We've shared with the Public Safety Committee some basic data that we tried to run and tried to do it. And the more we talked about it, the more layers that we determined were there, and you have to get deeper into that analysis, right? Why is there mutual aid? We aren't able to get that deep. We were able to figure out that there was mutual aid, but what is it because they're not staffed appropriately, the home agency? Is it because that agency's out providing mutual aid too frequently, so they don't have ambulances within their home district? So there has been appetite, there has been interest in it. We haven't heard any direct negative feedback from it. I think these agencies have interest, and the system is changing too, right? I think that's a good thing to look at. The state just passed laws that allow treatment in place, and I believe it's some alternative destination transport. And the laws really are designed on the reimbursement to that, to the agencies that do it. Those aren't in play yet because the policies haven't been developed, but they're authorized now. Whereas before, if a crew went to a call and they treated in place and left, there's no reimbursement to that agency. So that'll change things, right? Like those agencies will generate revenue on that now when there's a refusal. But that's all still to be seen, still figure out exactly how it's going to go. So the system is constantly changing. So when we use the word system, it's that whole realm of that.
I'm sure you considered this. I haven't worked with you guys for a long time and in lots of different ways. I know what you guys know, you and your team. Did you guys kick around any possibility of a more internal or local effort?
We've talked about it, and there's some buy-in.
I know it's a resource thing. But
it's a resource thing, I think. I think that there's some of it's the expertise of people that do this all the time. Some of the agencies are, they'll give us data, and then it's what do you do with it? And it's, I don't know that we have the capacity to do this internally, even if we bring in other people. I think it really will. I think it'll also really help to have somebody from the outside look at systems and how they exist in other places to make recommendations for how we can better work together.
Gotcha.
And the agencies work together, but I don't want to make it sound like they don't work together, right? Or the agencies, it's more of like how we can make the system work.
Yeah, I don't
together.
think that's even the problem
Yeah,
today,
no.
right? It's, but anyways, thank you. Appreciate
Julie?
it.
I have so many things that I want to say because I was a journalist and I would respond, and because I lost my son and I saw turf wars right in front of me, and so you'll see multiple agencies. You'll have an advanced life support call, and you'll have a helicopter there, but then a child is taken by a local volunteer ambulance to a hospital in another county. Like, these things that really could have impacted life-saving efforts happen.
Mm-hmm.
And even in my journalism, you stand at these scenes, and it's very disappointing. So I hear this, and I am so excited, but I wonder, is fostering those relationships, in cooperation and streamlining, is that part of what this is? Or even one more question for you. What, in your opinion, is the biggest public safety concern for you, EMS-wise, not public safety, life-saving EMS-wise right now in this county?
It's a really loaded question.
But I want you to be honest, because this is real.
It's very real.
And I've reported on it, and it's still exists.
I think one of the biggest changes is it has to happen at the state level.
Okay.
The state regulates all of it. The state, if you call that you stubbed your toe last week, and you demand an ambulance, and you demand to go to a hospital, they have to take you. Even though you've got a trained medical professional, paramedic level, saying there's nothing wrong with you.
Okay.
That's a drain on our resources, but there's no way not to do that. It's the regulation of the system. I think it was the state did a major update of the EMS regulations, and I am by no stretch an expert in state EMS regulations and the authorities that exist. It was 1980. It has been updated. So that's probably the biggest thing. The biggest changes to this entire thing have to happen at the state level because they regulate it. We don't.
I appreciate that. Thank you.
And coincidentally, or maybe not coincidentally, a lot of that ties to the timing of Medicaid provisions and stuff like that too, which also dictate.
That's like the pre-hospital, or the treatment in place, I think is the term.
Yeah.
Treatment in place that has changed. Before, you got nothing. Now they're opening an avenue. It's not done yet. They're opening an avenue to allow some reimbursement to these agencies.
So can I ask you one more thing? So once we gather this data, and it's such a great, I am fully supportive of this. I think it's awesome that you guys are forward thinking and really trying to do this. What do you do to share it? I mean, do you try to form a group coalition? Do you just hope that people come?
No, the EMS advisory board will be a big part of that, right? And the way we're working on the scope is that, we're expecting the selected contractor to, participate in the EMS directors' meetings, give them opportunity to provide feedback and information and recommendations even, right? I mean, these are some of the people that will have some of the recommendations. And then, also we have it where they have to have a draft, right? So we have to have the ability to review a draft and go back to them. So the idea will be to engage all of those stakeholders in the process all along the way.
Thanks, Dan.
That's key. Yeah.
Hey, so thank you for doing this. I know it's needed. I have a few questions will this give us recommendations for what we should advocate from the state, or state changes or things that are holding us back at the state level?
I would fully expect it to. I've never talked to an ambulance director that doesn't say that the state regulations that they don't need to change.
Yeah.
Everyone says they need to change, right?
Yeah.
If that isn't in here, I'll make sure it gets in there.
Yeah, I just didn't know if they were going to look at that level, right? If they were looking just at the local level, or hey, these are the things
We have to
state.
consider that because that's the rules that we have to follow.
Yeah.
Right?
Yeah. Just to know what specifically they would like to see change from the state would be nice, so that we can do that. And is this going to produce a public report that people are going to be able to see, or what's the outcome of this in terms of?
It's going to be a report. How public? I don't have an answer to that. I guess it depends on what exactly it defines and what is in it. Again, I'm sure there's at least summaries and basic information that will absolutely be shared.
Yeah.
And really, once you share it with 60 public safety agencies, that's pretty much public.
Yeah, understood. And do interfacility transfers fall under this?
They would probably from a resource perspective, right? Typically,
Yeah.
agencies are taking crews off of the road, out of the 911 system to provide those interfacility transports. I mean, some agencies do schedule interfacility transports as part of their scheduling, but they definitely play in this as a demand on the resources that we have, so I don't know how they wouldn't be included in it.
Okay. I don't know if it was like a separate thing.
Chris?
I will make sure that note is in there, because, you know, obviously you read this enough times, we think we know what it says.
Yeah.
So let me ask you a question, probably, I want to go back to something that Chair referenced about buy-in. You know, obviously, you can't say without hesitation who believes in it, who doesn't, or whatever, but what would you get the sense of buy-in from the other departments, right? We talk about a lot of agencies, a lot of departments doing a lot of different things, and I think that that matters, at least for me. But I don't want to put you, but as far as buy-in goes, I mean, so I'm going to support this. I think it's absolutely worthy, and we should be doing it. As chair of public safety for 4 years, you and I spoke a lot. And, you know, I think we could always do better. Every department can do better, but you know, but we're talking about, and $200,000 is $200,000. But in doing so, you know, sometimes people get stuck and like, well, I'm not going to do any of that anyway. So what do you get the sense of as far as cooperation goes or buy-in?
I think it's going to depend on which recommendation ultimately comes out of it and their level of support for those individual recommendations. I think, you know, we've talked with this, you know, since I got into this job, talking with the ambulance directors of the system as a whole. We talk about the data, we talk about, you know, and it's been challenging for them to do. There's always kind of been that interest to do it and to have those conversations. I think the real buy-in ultimately matters with the recommendations. And I think that the level of buy-in is going to change depending on what the recommendation is, right? You know, the two extremes are, we do absolutely nothing, the county takes it all over. I think you're gonna have that same spectrum of buy-in, right? And I'm not making a recommendation for either of those, but I think those are the two extremes on the recommendation level. So I think that buy-in level will depend on what that is. I think different agencies will have more interest in consolidating than others. You know, your smaller ones, your larger ones, they're going to have a different level. They have different resources, they have different call volume, they have different revenue models. It's going to change depending on which the recommendation is, I think.
So as far as recommendations go, are they going to be coming back to us afterwards? And I don't want to, you know, listen, last thing I'm going to do is sit here in this chair and try to micromanage any emergency services department or whatever, right? But are we going to be able to come back? We'll take a look at this before any policies are made. You know, this is still the policy-making body, right, of the county, and love to, you know, make sure that we get eyes on that before we implement anything.
Yeah, we would have to, especially if the county's going to implement something, because we right now don't have an ambulance agency. We don't have an ambulance. We don't have, right? So anything where we would have to come back here, even just from a financial perspective. If it's something that is wholly within the authority of the agencies themselves, we may not have that level of grasp into it.
Okay. Thank you, Dan.
Interesting. Julie?
Quick question, because you're the insider. Is there any appetite at the state level or big organized push to get them to update the archaic policy that they have?
There's been a number of pushes. It's been in the budget, some pretty significant changes the past couple of years, and it hasn't made it through inclusion in the state budget. And the state did a full report on kind of the state system as a whole as well.
How disappointing. Thanks.
Any other questions? Anyone want to move?
I'll move it.
Do we have a second? All in favor? Opposed? Motion carried. Thank you.
Thank you.
Next is an item for the county legislature. On behalf of the chairman, I will present this. This is a transfer of $50,000 from the 101 salary savings to the chamber improvement fund to make some updates to our sound system and other office improvements in the amount of $50,000. Any questions?
Looks fantastic so far.
Okay, good.
Comment, but looks great.
Questions?
Do we have a list of everything that's been done? Is it
the clerk can get that for you, absolutely get that for you, okay? Any other questions?
I'll move it.
Move it. Second. All in favor? Opposed? Motion carried. Okay. Next is local law regarding this, it's a school bus display, a red visual signal and stop arm. Yeah, I know, right? Chris, your title is Director of Security, correct?
Turn the mic. You have to turn,
I'm sorry, is that better? We're here to present a local law to establish a demonstration program with putting liability on owners of vehicles that pass a stop school bus. So far, there are several counties in New York State that have already implemented this. Closer to us, we have Albany, Oneida, and Broome County that are active. So far, steps we've taken, we've issued an RFP, not sure how far, last year or whatever that was, right? We're in a contract agreement with Vera Mobility, which is a company that's also operating the system for Oneida County and Broome County in this area. And what the program is going to do is hopefully reduce incidents of vehicles passing school bus that could lead to injuries of the children. So what we have right now is we're looking at a pilot program to start out with 4 districts. We're starting with Baldwinsville, Liverpool, North Syracuse, and East Syracuse, Manoa. All 4 districts have expressed interest in jumping on board with this program. They seem to be excited about it. Right now, we are in the process of having MOUs put in place with Vera Mobility, the county, and the school districts. Once those are in place, we'll be able to move forward with the company coming in and evaluating the fleet sizes and get a better timeline of when we can implement. We're shooting for the school year of 2025-2026 for this program. Right now, the way it works is Vera Mobility takes care of all the equipment, the installation. They oversee the program. They handle the capturing of the evidentiary information we need for the fines. That then in turn gets, once a video is captured of a vehicle passing a stop bus, that stuff will come to the county, will approve or deny the violation based on the circumstances of the evidence we have. Once that happens, they will then issue the fine to the owner of the vehicle. So it's similar to like the red light construction zone cameras that we're familiar with here. So fines will come back to the county. Right now, based on Vera Mobility's numbers, they're saying that they're looking at 90% accumulation where people are one-time fines. So about 90% of the violations are one-time. So it's having an impact on, it's considerable impact on the community as far as stopping this from occurring. So that's kind of the gist of the program, if anybody has any questions.
So, I think, speaking frankly, I don't know if there's anything that pisses me off more than seeing somebody pass a school bus loading or unloading children. And I'm all for this. I think it's a great idea and probably overdue. I have a ton of questions that I don't even know are necessarily appropriate for today. Again, I think this is more than a great idea. It's a good thing to do. I'd love to see this go back to the Public Safety Committee and have it vetted. I mean, the first probably, I've got questions, just personally have questions about the first 4 or 5 items in the local law. Just clarification, what does it mean, a little deeper dive on the funding, accountability. You know, this really puts the onus or responsibility on the owner of a registrant of a vehicle versus the violator. Are we square on that? Do we need to do some clarification or gain a better understanding of how we actually get to the root cause of the problem? Again, I'm sure there's questions for all of this, and I'm sure they're good ones. I really am confident of that. But I really think this should be sort of a deeper dive by the Public Safety Committee, whose area of focus is really aligned with this. I think we should have whatever discussion we want today. But again, that would be my request for consideration as far as action today's. Because I mean, 30 days, what's that going to matter, you know?
I know that, maybe this might be a question for Ben. How much of this, there was a bill that was
Yep.
about trying to get schools, districts on board to implement this. It kind of, school districts, because they had to be possible. How much of this is attributed to that law that was passed and what, how we're going to do that?
So the law was passed at sunset, and the original program, it drafted probably, the RFP went out in 2020. The contract hasn't been executed. We're executing that contract based on the RFP now. But COVID, and it was going to set to sunset in 2024. So when we were prepared to roll out, we're not going to roll out a program with substantial investment in putting cameras in buses and then have it sunset in 2024, even though we heard it was probably going to be renewed. So it has been renewed, and this is basically a recitation of the state law. All the interpretations of this law, and I'm prepared to address them today. I wrote this thing, rewrote it since 2020. I'm very familiar with it. And now the state has had 4 or 5 years to sit on this. They made a couple amendments here. Courts are more familiar with it now. The evidentiary procedures required. So it models the state law as reenacted.
Right, but the state law said this, but the state law, correct me if I'm wrong, the agency law that was passed kind of put it back on the school district or municipality because they didn't want to propose it, right? So it was the bond.
It's a local opt-in. Local opt-in. Yep, you have to opt in. You need this local law to enact a program within your jurisdiction. Once we act for the whole county minus the city. The city is exempted from and they have their own program, by the way, Stand It Up.
So we have to have, but the state law sunsets, the state law has to be passed again.
It would, it's another 5 years. So it would be, what does it run through? It'd be 30. I think December of 2030. Now, it's the second, more counties are signing up. I can't predict what the state will do in 2030, but it is, I believe it. Of course, that's the one thing
So another law doesn't need to be passed for us to.
No, nope. Once it sunsets, our program would sunset. Once the state authorization goes, ours would go to. They'd probably do it again. Yep. I'm not saying anything here. That's right.
So the county has to do this, not the school. The schools can't do it. The county has to do it as a whole, and then the schools buy in.
That's correct. Local municipalities can, but then it becomes, once we take the field, so we've been negotiating and talking to the school districts and kind of taking the onus to prevent little piecemeal. But yes, the way it works is our contract with Vera Mobility, the school district cannot have any charges or expenses underneath this program. It's actually built into the statute. So we enter into an MOU or 3-party agreement with the school district. This will authorize us to do this. That just allows us to install the cameras onto us being Vera Mobility. They do it all. Install the cameras on their bus. If a third-party bus company is involved, we'll get them involved too. So we're in the process of redlining with the districts we have signed up so far, those agreements. But it'll be an MOU for use of the camera system on the bus and a transmittal of the information with the school district, our contract with Vera, and Vera does they do the initial review of the photos, they do the billing, or they do the tickets, they do the collection, and Chris and maybe somebody else has the responsibility of it has to be a county officer, a technician, reviewing those photos as well as sort of a check. So he will be reviewing all the videos to make sure, pedestrians aren't shown in it, faces are blurred, and that the violation is a true violation. But that is sort of the county's, the rest of it's handled by the vendor, and they invoice us separately. So we have, our violation, the fees we collect are our fees, and they invoice us for their services separately. It's not a,
This is operating out of the violations. We're not putting any money into it. It's totally funded through whatever we collect in violations.
Yes, that's the idea. And actually,
Yeah.
the more numbers are out now because people have, when I was first inquiring, there was just a couple years of program. But now NISAC and everybody has been getting some data. There's been some news articles and reports. Counties are making, I think, when I talked to Broome County, in their first 1.5 years of rollout, which is really your substantial investment, you're putting up signage, you're doing, they made $400,000 under this program, and I think there was a little bit of administrative expenses they need to subtract to that, but it was a net And I think it's only gone up from there as administration costs have gone down. So it does seem to be it's not, the idea of the program safety, but it does appear to be self-sustaining in the programs that's been rolled out, plus, self-sustaining plus. It's actually been no revenue.
Yeah, we anticipate a spike in the beginning of rolling it out. Once the public's more aware of it, you're going to probably see it decline to a steady, more even stream of whatever the revenue is.
And you don't feel we're putting ourselves at risk at all for any liability as a result of if something goes wrong here?
Well, we've mirrored state law.
Yeah.
There will be, I do suspect, and they've told me that, especially being 275, in our area, people are more likely to make a stink, if you will, a legal stink. So they're more likely to challenge it. I do think there's going to be a attorney role, at least in the first, to really, because we're the ones who would have to take it to court if somebody doesn't pay. You don't want a paper tiger, right? You do want to enforce it. That's my policy. If you put in a law, you have to make sure people are following it, right? What's the point? So there will be some of that. There is some attorney cost and expense, but the numbers we've seen on paying are pretty good, and they get better as time goes on when people are more familiar with the program, and that you're not really. Is this your vehicle? It's hard. The court case is hard to win, especially now that we've had 5 years, and they've revised it a little bit to meet some of the evidence that judges were looking for. And some of the requirements.
So the understanding is this has been challenged down in Suffolk County and some other areas the program's already implemented in, and it's withheld legal standards. So there's been no successful overturning of it as of yet. But he also, these red light cameras had been in existence in some areas for a long time. It's a similar thing. You're capturing the owner of the vehicle is responsible, the driver's not, and it's a civil penalty.
Now, there is a proceeding where if you're the owner, you can then sue the driver, but that's not us, right? We ticket and then you take them to the court and say, actually, Joe, you were driving my vehicle, but that's not the county's realm. That's for them. That's a civil action to recoup your loss expenses.
What percent of these drivers are, or I should say owners, have their kids driving cars? So it's, I just, again, back to what I was saying earlier, I think this is awesome. Again, it never ceases to amaze me when I watched it happen that there are people who think their lives are more important, It's so important that they have to do that. But anyways, again, I just think it is worthwhile. Ben, I'm having flashbacks to, if you remember the license plate reader ordeal, you look at that through one lens and it's oh, good, we're going to, get the people we need to get to. And if you look at it at the other lens, it's, geez, and I see that a lot of that's addressed here, right? In terms of people who are photographed accidentally and that we're focused on the license plate versus the driver, things of that nature. But again, I just think it's we sort of make our hay here by being a little pragmatic, and I think a step to just review this in a little more detail would be wise.
Julie? Just take Julie.
Along that line, I couldn't agree more. It is infuriating. I'm actually surprised that it's in our purview at the county to permit. Like when I first started reading this in my packet, I thought, oh, is this the sheriff's department, local law enforcement that's going to do it? But is it because of the law? I'm just trying to clarify. Because of the law that gives us the power to do this, or how is that?
Yeah, I wasn't part of the beginning of the program, but I believe it was brought up to the sheriff's office at some point in the DA's offices, and they declined involvement initially, maybe. So it's counties coordinated regardless of which law enforcement entity is approving or denying. So it's just how it's set up. So we're gonna, even if it was the sheriff's department approving and denying, it would still be us coordinating the effort.
Got it. Okay.
Just to kind of get on to compound on that is. The sheriff's office, if they do issue a ticket, the sheriff just happens to be there. The problem is, when's the sheriff going to, what are the odds the sheriff is there when you actually run that stop sign, right? So if the sheriff is there, they issue you the ticket, this ticket goes away. You're one, and that's what, or that's your, it's separate, right? So that's still a ticketable offense for violating that statute, and you don't get double fined for it. But the sheriff's role, since it's so automated, some counties have, will put the sheriff as far as that technician who has to review the photos on the county level, but it doesn't have to be. The DMV, for their red light program, has DMV officials trained to do it. So, you know, with us having the sheriffs, it's a resource matter. Are the sheriffs better doing sheriffy thing?
Yeah, no,
Law
I'm
enforcement
just
things, or are they better reviewing these photos that Chris or I or anybody who is trained on it could read? So the sheriffs have been, you know, coordinated with, but there isn't a direct necessarily role in this program for it. It's much more of a
Okay.
automated traffic enforcement.
Okay, so are there districts in our county that already do this or have cameras?
The city has a program.
Okay.
I'm not aware of any school district.
No, I'm not, I spoke to the chief of the Syracuse PD, and they're still in the process. So they haven't executed on it yet. My understanding it's still at City Hall, so they will be doing one. But in the district, this will be the first 4 schools, so.
And not all districts, a lot of districts contract for their transportation services. So how does that get vetted or?
So the 4 that we are implementing this program with to start all own their own fleet.
Okay.
So that issue is not an issue right now. But there's a process. We just amend the MOU agreement, then we just have to add in the vendor that provides the bus services to the agreement is all.
Okay, thank you.
Welcome.
Other questions? Brian, were you saying that you would prefer to not act on this and that you wanted to
Well-
make a motion to refer it back to public safety?
There's no action to be taken today because it's a
Because it's a
local
local
law.
law.
But we
Like-
could today make a referral to informal, but make a referral to the committee. Ultimately, I think the chair would decide where it lands, whether it goes to session or it gets vetted in committee, either way.
Okay.
You know, but I mean, we could make an official statement if there, well, I guess it's your purview, you know, to decide whether it goes there, or we could just leave it to the chair. Come on, Ben.
Yeah, I mean, we could do a motion. Yeah, you're right. To your point, it would be advisory, sort of up to the, if it goes
Purely
to session or
advisory.
not, because it
Yeah.
doesn't need to be considered, right, or
And I
it
think,
has
you know,
been.
if you go back to 2020, 30 days isn't going to hurt anything here.
No, yeah.
You know.
Okay. Thank you.
Noted for the record.
Good.
Thank you.
Okay. It's local law. Right. Well, that's what we're going to talk to the chairman and see what the thought is whether it should go on for the next session or go back to public safety and then go on for the following session. Okay? Thank you.
Thank you.
Next is the Onondaga County Public Library for an intermunicipal agreement with the state of New York. Somebody, hi, from the library. And this didn't go to facilities either. This is good. Yep. Hello. Turn your microphone.
Sorry.
There you go.
The Onondaga County Public Library is seeking the authorization of an intermunicipal agreement with the State University of New York, College of Environmental Science and Forestry for a federal work-study community service program at our libraries. The libraries would like to be able to offer tutoring after school and early evening hours at 6 of our city branches for free drop-in support for students in grades kindergarten through 12th grade. The subject areas covered would be reading, writing, science, math, and we would like to offer it at Beecham, Betts, Payne Branch, Pettit Branch, Sewell Branch, and White Branch. Happy to answer questions.
I'll move it.
Yeah, okay. Julie?
Love it. I'm just curious, where does SUNY ESF come into?
I know.
I'm sorry, I just, like, wait a minute.
Yeah.
So,
I know it's like a win-win-win, the community, the students, both students, you know. We actually were approached. They have a community program where they place work-study students within the community. And I think currently they have some students working at the Y, and it's a natural fit for the libraries. We've got lots of students that need lots of help, and not only is it a benefit for their school subjects, but also it allows students to interact with college students within the city, and so I think it's a great program.
Total win. Thank you.
Good,
All
thank
right.
you. Chris, were you seconding it? I was seconding. Okay, all in favor? Opposed, motion carried. Thank you.
Thank you.
That's it, we're adjourned.